Hello and good afternoon. Welcome to our COVID-19 update with the county's public health experts coming to you from the safety of their private offices. Today, you will hear from the county's Director of Public Health, Dr. Vaughn Dorenoso, to be followed by Dr. Henning Ansorg, the county's Public Health Officer, who will then be followed by Nick Clay, Director of the Santa Barbara County Emergency Medical Services Agency. Following their updates, we will open it up to questions from the news media. As a reminder, this press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Julia Townsend. Videos of the press conference will be available shortly after the conclusion of this press conference in English and Spanish on the county's YouTube channel at CSB TV 20. In addition, Cox Cable subscribers can view this in Spanish. With that, I will turn it over to the County Public Health Director, Dr. Vaughn Dorenoso.
Thank you, Gina. Good afternoon. Can I bring up my slides? Great, thank you. I'd like to begin my briefing with a summary of our current vaccination efforts. As of this week, we have been allocated 51,375 vaccine doses to our Santa Barbara County. I'd like to note that each individual vaccinated will need 2 doses. So we currently have an estimation that there are over 26,000 healthcare workers throughout the county. And there are approximately 36,000 county residents over the 75 years of age. With limited vaccines, we must prioritize who gets vaccinated until our supply of vaccines increase. So when we combine both the healthcare workers and residents who are 75 plus, we would need over 124,000 doses of vaccines. Next. The order of priority is based on data. Right now, we are vaccinating frontline healthcare workers with direct patient care. And then we are also concurrently vaccinating persons aged 75 and older. Frontline health workers with direct patient care are more likely to be infected and must be prioritized so that we can maintain our healthcare system and ensure high quality patient care. Persons age 75 and older are faced with higher mortality rates and are also being prioritized above those age 65 and older. Next. Community members 75 plus will be alerted of open vaccine appointments if they can sign up for our vaccine newsletter at publichealthsbc.org or call our call center at 211 and select option 4. Our approved medical providers will also be contacting eligible patients to schedule vaccines. And in addition to that, as we are made aware of vaccine clinics that our healthcare providers are hosting, we will also post that information on our website, publichealthsbc.org, and send the information to our community partners to broadcast that opportunity. Next. There's been a lot of questions and confusion around how to schedule a second dose. If you receive your vaccination in one of the public health department community vaccination sites at Allen Hancock, at the Lompoc Veteran Center, at the Santa Barbara City College Wake Center, you can either schedule an appointment by calling our 211, or we can also call you. So we are ready and available to assist if you contact us. Most of the second dose recipients have been contacted, and if you haven't heard from us and it's about due, please contact us as well. I'd like to share with you, and you may have heard of this already, but California will be transitioning mid February to a unified statewide network that will allow the healthcare system and providers to streamline the vaccine process. Public health will continue to serve as a safety net for those who are unable to access the healthcare system. So, what this means is that mid February, Blue Shield will be allocating vaccines directly to providers, which will include pharmacies, public and health and private healthcare networks, hospitals, pop up sites, and community health centers. The safety net population that public health will serve include the homeless population, mentally ill and substance users, undocumented community members, and other hard to reach population. The state intends to that this centralized system will assist the state in notifying residents of scheduling appointments and determining eligibility. And that system, that centralized system, is called My Turn. And we will be hearing more about My Turn in the coming weeks. Transitioning from vaccines to testing, I'd like to share with you that our mobile testing unit will be moving to Lompoc beginning February 1st. We can begin to accept appointments. Go online at lhi.care/COVID testing, or you can schedule a testing appointment at 1-800-634-1123, or you can also call our call center at 211 if you need help scheduling appointments. And the site of this mobile testing will be at Bryan Park in Lompoc. And so that's at 800 West Ocean Avenue in Lompoc, but it is available for countywide residents. Lastly, I'd like to update you with our COVID by the numbers. As anticipated, our COVID numbers are gradually improving. The following data is from the third week of the year, so from January 17th through January 23rd, compared to the prior week. This week, our newly weekly cases decreased by 23%. Weekly active cases decreased by 17%. Weekly death decreased by 47%. And our weekly testing positivity decreased by 15%. However, our new cases, deaths, active cases, and hospitalizations still remain elevated. Today, we are reporting 406 new cases. We are also reporting, unfortunately, 4 new deaths, 1,612 active cases. We are reporting 180 hospitalizations with 48 in the ICU. And Santa Barbara County ICU availability adjusted stands at 16.7. While these decreases I mentioned earlier are good, are promising, and encouraging, they are still unacceptably high. So, what this means is that we still need to maintain our diligence in preventing the spread of disease in our county. With the governor's next, with the governor's decision to end the stay-at-home order, it is exciting that we will now have the opportunity to enjoy increased activities in the various sectors, such as outdoor dining and salon visits. I I I am thrilled and I encourage everyone to support local businesses. However, please remember that COVID activity is still widespread in our county. So you must remember the 4 W's. You need to wear your mask and watch your distance. Stay at least 6 feet apart. Remember to wash your hands and really limit your gathering. Thank you. And now I'd like to introduce Dr. Henning Ansorg, our County Health Officer.
Thank you, Director Do Reynoso. Good afternoon, everyone. I would like to speak about our available and soon to be available vaccines. The Pfizer and Moderna vaccines were both approved right around Christmas, and they show to have a 95% efficacy to prevent COVID in their clinical trials. So far, over 3 million doses have been administered in California alone, and only a few significant vaccine reactions have occurred. By now, we feel comfortable to state that these vaccines seem to be quite well tolerated. We were glad to hear today that Johnson & Johnson is planning to apply for the FDA emergency use authorization next Friday. The company reported today that the vaccine they developed was 72% successful in preventing COVID in the US population. The advantage of this new vaccine is that it only requires one dose and it can be stored for up to 3 months at normal refrigerator temperatures. These factors will make it a very attractive option for use under specific circumstances. For instance, if reliable follow-up for a second dose is not feasible, or for use in community outreach operations or smaller clinics that do not have the ability to keep frozen vaccine at hand. Once the FDA emergency use authorization is granted, this new additional option could become available as soon as by mid-February. The company has produced 7 million doses as of now and is slated to have 30 million ready by the end of April. You may have heard that England is considering to space out the 2 doses of the Moderna and Pfizer vaccines. The argument for going this route is that one shot may provide already significant protection against COVID, and that by giving out more first doses, a larger percentage of the population would get some protection while the vaccine is generally still scarce. This argument has been vetted very thoroughly by the CDC in the States and our Western State Scientific Work Group here in California, both of whom came to the conclusion that the 2 doses should not be given more than 6 weeks apart. We want to make sure that an optimal immune response to the vaccine is guaranteed. The available scientific data are simply not compelling enough to rely on just one single dose, in particular in the elderly, who generally have a less robust immune response to vaccines. Postponing the second dose beyond 6 weeks could possibly lead to an overall reduction of effectiveness of the vaccine in preventing COVID. We now are 1 year into this pandemic. Viruses do adapt and change over time. Any combination of mutations in the virus that provide an advantage by letting it spread faster and easier will quickly become the predominant version of this new virus form in a certain community. We are witnessing this phenomenon in England and South Africa and possibly Brazil and even in California. These new variants of the original virus were able to become more sticky to human cells and therefore can infect them easier. They are also able to evade the antibodies to a certain degree. The new Johnson & Johnson vaccine, for instance, was only 57% effective when tested in South Africa. The antibodies triggered by the Moderna vaccine are slightly less potent against the South Africa variant. All manufacturers are already working on booster shots that would target these new virus strains. Unfortunately, with new virus strains, it is conceivable that someone who had COVID from the original virus and developed immunity against it may not be well protected against these new or any future mutated viruses. So, how can we protect ourselves from these more contagious virus forms? Practice safe and proven behaviors. Avoid travel, avoid crowds, wear a mask, and keep at least 6-foot distance from others. Please favor activities that are outdoors and wash your hands frequently. The less people get infected, the less chance we are giving these mutations to become the dominant virus in our area. Thank you for your cooperation. I would like to introduce Nicholas Clay, our Director of Emergency Services here at the Public Health Department.
Hi, good afternoon. Thank you, Dr. Onzorg. Today, I would like to talk about the COVID-19 vaccination efforts that have been going on in the county over the past several weeks. Let's first talk about the current vaccine supply allocation process. The federal government, specifically the CDC, allocates or assigns vaccine to the California Department of Public Health, or CDPH, on a weekly basis. There are two separate allocations, a first dose allocation and a second dose allocation. CDPH then allocates vaccines to the County Public Health Department. This vaccine is for all approved COVID-19 vaccine providers in the county. The Public Health Department then allocates these vaccines to each of those approved providers. So how does the County Public Health Department allocate vaccine? Allocations are based on the following criteria listed in the order of importance. Reported inventory on hand. Does the facility report they can administer the vaccine in a 96-hour period? What's the patient population they're targeting? Geographic distribution across the county, and lastly, their targeted community. We began this process in December as the County Public Health Department began receiving COVID-19 vaccine allocations. These early allocations were immediately shared with our hospital partners to begin vaccinating those healthcare providers in the top tier of Phase 1A. As a county, we're leveraging the broad and well-established healthcare network in our community. This allows us to maximize our footprint when vaccinating the community. We have continued to grow our network of providers receiving vaccine as these providers have been able to comply with the vaccine allocation requirements set forth by the federal government. Prior to the beginning of this week, 17 organizations have been approved to receive vaccine, all of which have received vaccine. So what types of health organizations have received the vaccine? The county has allocated 22,525 vaccines, or over 50% to the hospitals. We've allocated 18,700 vaccines, or 42%, to clinics, including the public health vaccine clinics. Pharmacies have received 3,200 vaccines, or 7%, and healthcare providers have received 400 vaccines, or 1%. As a collective, this group has administered 74% of the vaccines they've received, which is a mix of first and second doses. The remaining vaccine doses will be used in upcoming appointments over the next week. I'd also like to touch on the county-run vaccine clinics. We began offering vaccination clinics to qualified members of the healthcare community on January 5th. Since then, these county clinics have vaccinated a total of 7,271 people. This represents only about 20% of the total vaccines that have been administered across the county and is a mix of healthcare workers and community members over 75 years old. Specifically, the county-run clinics have vaccinated 2,202 people over the age of 75. I also want to acknowledge that the county vaccination effort has truly been a county effort. The county family has come together to ramp up our vaccination efforts. We're receiving reassigned staff from various county departments. Ellen Hancock College has been a great partner. Our cities have provided support, and our Medical Reserve Corps volunteers have been an incredible support, participating in every clinic that we have offered. Lastly, I want to recognize our county fire department and others who have joined us in a true partnership as we navigate the various challenges of such a diverse operation. So what's next in our vaccination efforts? As Dr. Del Reynoso mentioned, there are some shifts in how the state will allocate vaccine. This results in a shift from the public health department in our vaccination efforts. Over the next 4 weeks, we are focusing on using our limited vaccine supply to deliver the second doses to all of those who received their first dose from the county. At this time, we're unable to offer any first dose clinics for those who qualify. Should additional vaccine become available from the state before we transition to the state's new model, we can reevaluate our clinic schedule. As mentioned, this new state process should be in effect by the end of February, and the public health department will then focus on those who fall into the safety net category as mentioned earlier. We are actively planning on how we can best serve this community, which will likely involve mobile vaccine clinics and working with various partners to ensure we reach this group. Lastly, the public health department is partnering with the Department of Social Services and other community partners to ensure vaccine is available to those who are 75 and older in underserved communities as defined by California's health equity metric. As more details become available, we look forward to sharing them with you. We want to thank our community for the desire to get vaccinated and the patience as we wade through these vaccine issues. Please remember that vaccination is only one tool in our toolbox to beat COVID-19. Together, we'll get through this and we'll look forward to continue our partnerships and efforts to vaccinate the community. Thank you.
Thank you, Nick and everyone. So next up, we'll go to questions from the media. First up is Blake Devine with KYT.
Hi guys, first question for me. I just want to clarify how many doses of the vaccine did Santa Barbara County receive in the last 2 weeks and how many are ordered for next week?
So we cumulatively, prior to this week, we were allocated and received 44,825. And this week we are slated to receive about 6,000.
And then
that includes, and that includes first and second doses.
That makes sense. At this pace, how long will it take to supply the whole county for those who want to be vaccinated?
It's not a linear trajectory because week to week we are unsure of the number of vaccines that we will be getting. As I shared earlier, we anticipate that the state is going to shift to a centralization of vaccine distribution. It may be with the new federal leadership and the new centralization that we will get increased number of vaccines to our county, albeit distributed differently. So it's hard to project given all the unknowns.
And then lastly, for me, obviously this weekend with things opening up, the weather's going to get a lot better. What would be your warning for people that are going to be going out, enjoying restaurants and all those activities that have now reopened now that the stay-at-home order is over?
I would say let's celebrate the freedom that we have, but let's really make sure that we observe the precautions that we've been messaging since day one, which is wear your mask. This is not a time to be less diligent. So everyone needs to wear a mask and maintain the social distancing, wash your hands, and really make sure that if you gather, make sure that those are outside activities and in the shortest amount of time possible. I want to remind everyone that the disease is still widespread in our county, even though the regional stay-at-home order has been lifted. We are in the purple tier and we need to decrease the disease transmission so that we can advance towards the next tier.
Thank you so much.
Thank you, Blake. And next up, we're going to Tom Bolton with Newshawk.
Good afternoon. My first question is a follow-up to Blake's question, and that is, I'm wondering what success, if any, you've had in your appeals to the state for more vaccine doses.
We have not been successful. We did put ourselves 2 weeks ago on the waiting list for 10,000 vaccines. Last week it was 20,000, and we have not received any additional beyond what we received. And I would imagine that that is a factor of all the rest of the counties asking the state the same, and the severely limited number of vaccines flowing from the federals to our states to be allocated.
Do you know if any of the other counties are getting additional vaccine doses?
I am unaware. I do not have that information.
Okay. My second question is, you talked about how the numbers are improving, and yet today you reported 406 cases, which is the largest number in about 2 weeks. Can you talk a little bit about what that number represents and how it's arrived at in terms of, is that a surge, or is that just the fact that a lot of cases happen to get reported that maybe go back several days or even weeks?
You answered the question for me already. So absolutely. So the cases that we are reporting today is an accumulation of all the cases that could have been reported or tested a few days prior. So in our analysis, that's why we have a 7-day lag in our analysis.
So that number doesn't necessarily represent some sort of a surge in actual cases.
That is correct.
Okay. My last question is, I got an email today from somebody who is concerned about a church in Santa Maria that they say is continuing to hold services indoors without masks, without social distancing. The person claimed that they have, that this has been reported to the county, and yet it's persisted through the stay-at-home order and through the purple tier. And so I'm wondering what happens when something like that is reported to the county. Why is something like that, again, assuming this is all true, why is that persisting?
You know, that's a really good question. I am unaware of such a report, but typically when our county receives a complaint, we do send out our ambassadors to have a conversation to correct this situation. And then we are proceeding to engage our city code enforcement into that conversation with the entity to assure compliance. So I'm happy to to talk offline with you about the church that you are aware of, and see if we can have some follow-up conversations with that entity.
Okay, yeah, I don't want to name the church because I obviously haven't confirmed all the details, but the person who emailed would seem very concerned. So I'll share that with you, and obviously it's up to you to follow up.
Right. It is concerning to hear about that. And I just want to urge, it has, Dr. Ansorg mentioned that it's been a year. It's been a year of really tough sacrifices. And at this point, I just want to encourage all of our entities, our faith-based communities, to really adhere by the health officer order in the purple tier, which means that churches need to be outside.
Yeah, well, and it seems like it's a particular concern in Santa Maria since that seems to be where the largest number of cases has been throughout the pandemic, and you reported 150 cases today. So anyway,
Right.
thank you very much.
Thank you.
Thank you, Tom. Next up, we're going to Fabiola Navarrete with Two Tempo Digital, who will be followed by Laura Place with Santa Maria Times, and then the UCSB Daily Nexus. So with that, Fabiola, go ahead.
Can you hear me?
We can.
Okay, thank you. Okay, good afternoon. We have seen and we have heard that many businesses are not following the guidelines, and they are offering service inside, and they are not respecting social distancing. So we really want to know, what are you doing about this, and if you are aware of this situation, and if they will receive a fine as a consequence of these actions.
So that it breaks my heart. It is so unfortunate that there are. I totally understand, and again, the difficulty, the challenges. It's been a tough year. Really has been on the for community members and for businesses, and it's discouraging to me to hear about businesses not complying. And from a public health perspective, we have these guidelines in place so as a community, we can get out of the purple tier, then we can move towards the red tier, and then we can achieve more freedom as our cases go down. And so I'm really needing our community to work together just for a little bit longer so that we can decrease our disease transmission. With regards to businesses not being in compliance, I when we are aware of it as a county, we do engage our ambassadors to have those conversations with those businesses to one, educate, and two, to make them aware of the health officer orders and the limitations of how they can operate, and three, to really make sure that we have removed all barriers into compliance. And then fourth is that we do have administrative fines in place, and we are actively working with our code enforcement to elicit compliance. But this is a really situation where we're almost there, and we really need to hunker down and be compliant so that we can decrease the case rates. And as soon as we can decrease the case rates, then our schools can open, and more normalcy can be resumed.
Okay. Do you have a list of businesses that have violated the rules? Like a list?
Yes, our county does have a list of the businesses that we have received complaints and that we have reached out to.
Okay, thank you very much. That's all.
Thank you, Fabiola. Next up, we're going to Laura Place with Santa Maria Times.
Hi, thank you. My question is, I was wondering how many people in the county you estimate have received 2 doses now of the vaccine? And also following up on a question I had for you, Dr. Dornosa, last week, just how many healthcare workers you estimate now have received both doses, if you know that?
I'm going to ask Nick if he has that information available.
Yeah, so only can speak to what we've done at our vaccination clinics that are run by the county. And so far, it's been about less than 100. I don't have the exact number in front of me, but it's estimated to be less than 100.
Less than 100 healthcare workers vaccinated at the clinic?
Just at our clinic. So again, we started allocating to the healthcare system much earlier than we ran our clinics. So it's highly likely that number is significantly higher within our healthcare system as a whole. And then beginning this week or next week and the rest of the subsequent weeks in February, we will be doing all of our second dose vaccinations for the healthcare workers that we vaccinated.
Laura?
Okay. Yeah.
I'd like to share that we have the data for our community health clinics. We don't have the data from the majority, our healthcare providers. So that amounts to 80% of the vaccinations that's happened. But we anticipate the being able to access that data and sharing that data, the demographics of all of the vaccinations in our county. We're hoping to as early as late next week. But definitely that is something that we are working on, and we anticipate publishing this and on our website in the near future.
Okay, thanks for that. Yeah, I'm curious, is it just kind of everybody getting on the same page with the reporting system that's holding up, being able to receive all that data from providers? Since, like you said, they make up, 80% of where the vaccines are going. So, I mean, what barriers are there right now to being able to get a consistent flow of information from non-public health providers about their, use of doses and allocations and all that?
Sure. So the information right now, providers enter the information into the care system, which is the California Immunization Registry. And so there's data lag, there's data incompleteness, and data scrubbing that needs to happen before we can reliably count on that data. So part of that, our EPI team has been working to scrub the data, make sure that the data is complete before we can share that with the community. And I think that and that's probably one of the drivers of the state using investing in My Turn, so that the data could be more complete, the data can be more timely, and the centralization of the data as well as the vaccine distribution. The state hopes to address those issues via the new vaccine plan.
Okay, thank you for that explanation. Lastly, for me, let's see. I believe, oh, sorry, had to gather my thoughts for a sec. So with the county health clinics or vaccination clinics that you mentioned, I believe it was you, Dr. Doranosa, who said that for the next 4 weeks, the county will put off or have to stop opening first doses to people at those clinics. So is that just at the public health clinics, or is that a county-wide kind of shift where a lot of the different providers will be focusing just on second doses for the next 4 weeks?
Nick, can you answer that question?
Sorry. So it's just at our county public health clinics. The various other clinics throughout the county, again, as Dr. Doranosa mentioned, it's just representative of 20% of the total allocation to the county. And given the fact that we do not have enough doses to start first dose clinics over the next 4 weeks, it'll be just limited to our clinics, and we'll be focusing solely on second dose clinics, second dose administration.
Okay, thanks very much.
Thank you, Laura. And next we're going to Mika Iyer with Daily Nexus from UCSB.
Hi, hope everyone's doing well. My question is for Dr. Del Reynoso. Earlier this week, you mentioned at the Board of Supervisors meeting that while many areas in Santa Barbara County's cases are coming down, that the city of Santa Barbara, their cases have remained stagnant while Isla Vista's cases have continued to rise. I was wondering if that is a continuing trend and if you could speak to any specific reason for that trend, such as partying or students returning to campus.
Thank you for that question. With regards to an update to that, I'll have an update on Tuesday at the board with regards to the trend in Isla Vista. With the students with UCSB resuming in person, and with the increased number of students back into the Isla Vista, we can attribute the increased cases and the increased activities of the residents in Isla Vista.
Thank you so much.
Thank you. And that concludes our Q&A and our press conference for today. The next public health update will be to the Board of Supervisors this coming Tuesday, February 2nd. The meetings begin at 9 a.m. You can watch the board meetings live on Cox Cable Channel 20, youtube.com at CSBTV 20, or via the county website at countyofsb.org. Otherwise, the next press conference is next Friday, February 5th, beginning at 4:30 p.m. For more information and links to the county's public health data dashboard, vaccine information, FAQs, informational videos, and more, please go to www.publichealthsbc.org. You can also call 211, enter option 4 for information or to be connected to the county's call center. Callers outside the 805 area code may call toll-free to 1-800-400-1572, and again, select option 4. As always, remember to wear a face covering and stay at least 6 feet away from other people. Wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. Stay home and work virtually as much as possible, and only leave the house when absolutely necessary. If you feel sick, stay home Don't go to work and please isolate yourself. Call your doctor or a clinic and follow their medical advice. And with that, we wish everyone a happy Friday, a good, healthy, and safe weekend. And we will be back with you next week. Thank you so much and have a good night.